All right, thank you for staying with the Monday Report. The discussion continues. I see a lot of questions online here, but there's also a lot of questions from the audience. Let's start with the questions on that line. I'll take 4 of them, the entire line, so that we move really quick. Yes, start with your name, ma'am.
Good evening, everyone. My name is Florence Riaga. I have like 3 questions, just a quick one. One is, you talked of PPEs. I would like to just request that you be specific enough to the point, because remember, people are also online, and some are not even medics. They don't know what a PPE is, and what are they supposed to use. Do we have an industrial PPE when it comes to the mask? You be specific on that, because you see, there is occupational asthma. And then also, Doctor, another question goes to the panel. You talked about the syrup not being given to pediatrics, specifically under 12 years. What are you doing as the Pediatric Association of Kenya to stop this? Because recently we had the Benylin syrup on being discontinued. And apparently I walked into one of the pharmacy, and a big one, and the Benylin that specifically that was stopped was still on the shelf. So does it mean that together with the Kenyan government, they're doing nothing about this? So please help us on that. And I also want to talk about something, I don't know whether you've heard about this. Yes, we have asthma patients, but they're doing all trial and error method. But I may say that during COVID, this somehow worked, because I happen to have worked in a COVID unit with a patient who was on machine, and somehow the essential oils really worked for them. And some of the patients who are asthmatic, they've abandoned the inhalers and they've resorted to the essential oils, and they're really working for them. To be precise, the eucalyptus oil and the peppermint oil. Such that some are even using the eucalyptus crystal, where they put it into a vaporizer, and then the entire house is just so that they just inhale it. So instead of going for the nebulization, it has really worked well for them.
Right. Got it. Pass the microphone, please.
Good evening. My name is Naomi. I work at Alliance Girls. Now, my concern is the students. I deal with students who are asthmatics. And now the problem comes when there is hyperventilation. We talked about stigma, but on the contrary, unfortunately, sometimes for my girls, it's swag to be asthmatic, because you want to do some things, some duties. So where do you draw the line between being an acute asthmatic attack and hyperventilation, whatever they call hyperventilation? And how are you going to... Now, all these children, most of them will come with inhalers, all sorts of inhalers, and they'll tell you all sorts of treatment from their doctors. How do you handle it? Okay. And now, in my capacity as a nurse, yes, I'm qualified as a nurse, but then how do I convince this child that your doctor, whatever medication, they have given you prednisolone, and I don't want you to take it, for example. This is the advice. How do you convince this student?
All right, let's take another question there.
Thank you, Trevor. Good evening, everybody. My name is Pauline Mambo from Dandora. I'm an advocate of sexual reproductive health rights for young girls in Mathare and Dandora. Just by the mention of Dandora, I'm sure you have a picture of the dangers that we are exposed to by the toxic chemicals from the waste that get disposed every day at Dandora dam site. So my question is, what are the basic measures that you'll advise myself and 100 others that work at the dam site, given that we have to inhale the harmful gases all day, plus those that live around the dam site? What measures would you advise us to take to curb the spread of asthma without telling us to vacate or avoid the dam site, please? Thank you.
All right.
Well, thank you so much for the insightful sharing that you had as a panel. My name is Edith Idenya. I'm a veterinarian by training, but currently working in the financial services under Britam. Now, I heard something very interesting from Dr. Buika that asthma is not curable, but I got my asthma when I was 9 years old. 44 years later, I'm still asthmatic. But we were told that as you grow up, the asthma disappears. Is that a myth? Is that a fact? Has that been affected by development? That's my question.
Okay, let's take the 4 questions really fast and then we'll take the next line. And be very brief. I'll start with you, Dr. Wika. There's a question from Kidenya here. Does asthma disappear as you grow older?
Okay.
Yes or no?
Let me start with the personal protective equipment question.
Yes.
So I have to say that there are irritants, there are allergens, and there are poisons. And there must be some industrial occupational health departments somewhere that can advise people on what personal protective equipment they should wear, depending on what their exposures are. I don't know that there is one and where that information is, but there should be. That is the ideal scenario. I couldn't give you a generic answer to all those 3 different things. As pertains asthma, it does not, as I said earlier, you don't outgrow it. Control depends on exposures, depends on what is going on in your body as a human being. And remember that there are people who develop asthma later on in life. So all these are a combination of your physiology, what's going on in your body, what's going on in your environment. So you have varying expression of the asthma, varying severity, depending on what's going on in your life. Okay.
And Pauline was very specific. What basic measures can they take at the dump site in Dandora without telling them to leave?
Oh yeah, so for asthma, it's very simple. These things are allergens, they cause you asthma. You just have to, there needs to be a barrier between you and those things. So whether it's wearing personal protective equipment, whether it's lobbying the government, lobbying the necessary government agencies to get these things removed, then the right thing needs to happen.
So
the doctor will just tell you.
Basic mask work.
No, well, that will only work when you are talking about droplet infections or droplet carried infections. It won't work for asthma necessarily. It may, it won't necessarily work. It depends on what the problem is. If it was cold, for instance, if it was fragrances, if it was pollen, some could go through, and you couldn't live your life behind a mask either. Yeah.
All right, Dr. Adil, there was a question about the syrups that you talked about, what is being done to stop them, and then there's the essential oils, eucalyptus and peppermint.
So the Allergy Society of Kenya, the Kenya Pediatric Association, the Respiratory Society of Kenya have all issued clear consensus statements that cough mixtures should not be used for any child under the age of 12 for any reason whatsoever. You know, Trevor, there's just so much that an organization and a body can do. The architects will come and say, we must make a building like this, and we must have the foundations like this, etc., etc. But then it also needs other players to then come and enforce that those things are done. And when you're fighting these hard battles, and when you're fighting against the dollar, you can understand where this conversation kind of heads. But I always believe in one principle, which is what we're doing today in this town hall, is sharing knowledge with the public. You see, a politician is a politician, but a Kenyan mother can never be cheated. I have a bias against fathers, apparently. But a Kenyan mother is the most beautiful person on this land. Once you have given birth and breastfed a child, you know what it takes. Us men, we don't get it, Trevor. So let me tell you something. Let us empower our people. If the bodies and the higher powers cannot control, let us empower the woman, because a woman is a powerful lady. That's number one. Number two, essential oils. The problem lies within the name itself. Trevor, if I tell you that something is essential, you think, aha, very important for me. I must get it. And then I add the word oil. Ah, beautiful. Makes sense to me. So the wording is in that marketing, essential oil. I'm not trying to belittle the person who asked me the question, but this brain is a very powerful brain. If I tell you, Trevor, that this person, John here now, is HIV positive, John's going to have diarrhea and poor appetite within hours. That is how powerful your brain is. So a lot of these things are placebos. Kenyans are wasting money, humidifying their houses, purifying their houses, all sorts of gadgets. And I'm telling you, Trevor, I'm repeating what I said a few minutes ago. An inhaled steroid spray with a spacer device, with another inhaler when you're in trouble at 400 shillings per month and leave all the other drama alone. My colleague from Alliance Girls School, hyperventilation and asthma can look very similar. But when you check the oxygen, in asthma, it's down, and in hyperventilation, it's normal. Trevor, you and me, also my other brothers and sisters, our oxygen right now is at 98, 99, and 100. When you have a hyperventilating student or adult or one of us, you check the oxygen. If it's 99 and 100, you don't need to worry. It's most likely a panic attack.
Okay. All right. More questions coming through. Let's pick up another line. Yes, back there. We haven't been back there for a while.
Thank you, Trevor, for this opportunity. My name is Victor. I'm also a clinician. The first question will be, at what age is it that you can diagnose asthma? And to answer the lady that spoke earlier, there is a respiratory mask, like N95, that can act as a barrier if you are exposed to a lot of allergens. And the next question is, in occupational health, we've seen that asthma is now becoming like an occupational health disease. What measures are we taking to ensure that the perpetrators, like for example, the companies that are doing this, that the companies that are exposing their people to these allergens, what actions can be taken from a health perspective, maybe from a government perspective, to ensure that probably this is reduced? Okay. And then finally, if, for example, we are talking about carpets being able to expose us to allergens, I had a case, for example, at workplace where someone said, again, this is all about occupational, someone said that they were exposed to asthma at workplace because of the dusty carpet. As in this case, there is no need actually for you to put on a PPE at workplace. How do we treat such?
Okay.
Thank you.
Let's take the next question there.
My name is Liz Milgo. My question is to Dr. Adil.
Yeah.
Most times when you take a child to hospital, the first line with a cough and a fever, the first line of treatment would be, you'd be told to get an antibiotic, and antihistamine, and a syrup, Ascoril, most times, or one of these other cough syrups. As a parent, what questions should you ask, or what caution should we take as parents so that we do not end up treating a child for a chest infection, yet it's just an asthmatic attack, which you've mentioned is viral? And is it that if someone is asthmatic, they're prone to a chest infection, for them to be given an antibiotic treatment?
Okay. I believe we should be able to take maybe 2 more questions. We're really pressed for time here, and there's a front row here. The microphone came to you first. Okay, let's go.
Sang, also a clinician.
Yes.
So Joanna has talked about stigma, which probably could be stigma from the external environment or self-stigma. So I would really want her to give us the role of psychological counseling in asthma management. And again, stigma is always related to asthma, most probably maybe because of the other diseases that presents with a cough, probably maybe because of TB. Always very stigmatized. So maybe for Doc, if you could enlighten maybe our viewers that if this cough, if not asthma, what probably else could it be? Thank you.
Okay. All right, remind me your name again? Sang. Okay. Yes.
Okay, good evening. My name is Beatrice. My question goes, I have a sister. She's asthmatic. I'm asthmatic as well. Of late, we took her to the doctor and we were told that she's anemic. Every time anemic, the blood is down. So me too, when I go to the hospital, same situation. So does asthma also cause anemic? And number 2, my question is, when I was young, we couldn't afford the asthma tablets or the medication for asthma. So they used to buy me Franuls. And anytime I would take Franuls, I would get more weaker than I was before. So when I'm recovering, the more I'm getting weaker. So I don't know if there's any medication apart from Franuls, or are they also effective to asthma people?
Okay.
Yeah.
All right. Dr. Adil, I'll start with you and can answer any of the questions that are coming to our panelists. So you can pick any of them, but there was one directly on how early can you diagnose asthma?
That's a wonderful question. I've been lecturing now for 18 years. We used to say 18 years ago, Trevor, that you cannot diagnose asthma in children under 2 years. And I was living with that philosophy, and that's what I started working at. And that I lived my life and taught that song. But as time has gone on, and this is so unfortunate, that number is coming lower and lower and lower. And so even as of a few days ago, I was picking up an 11-month-old and a 10-month-old with this condition. And you can blame our weather, climatic changes, the smog, the pollution, the car exhaust. We used to be called the green city in the sun, Trevor. Mm-hmm. When I was growing up, it was green fields. There is no green space. You need to have our trees to generate and take away our carbon and our carbon particles and our carbon imprint, etc., etc. So to answer the question directly, because I know it's late, at the age even around 15 months and beyond. But I tell you something, if a clinician is diagnosing asthma between the age of 9 months and 15, I'm not trying to front for my colleagues, but at this point in time, you'd want a chest specialist to take a look, because you don't want to start a 11-month-old child on steroids and you don't know what you're doing. Mm. So at this point in time, it becomes complicated chest medicine, and you would want to send it to a chest specialist wherever. Second question that a colleague asked out there was, oh, you know what, how do I handle this? My child, I go to the casualty, my child has a fever, and this is going to be the most commonest question in pediatrics, for example. So the thing is this, I always say one thing, let's know, Trevor, what not to do. So I wouldn't give an antihistamine, FYI, and that's going to be a conversation, a full-blooded conversation for another day. I belong to the group of thought that says salty water nose spray in the nostril, because that's just like tears, Trevor. So it has no side effects and no cost per se. Your nose is blocked. Makamasi inatiririka. Sawa. Spray the saline nose spray. Don't do the antihistamine. Same story. Antihistamine goes to my entire body. Trevor, you want to treat 1 inch of my nose and you treat my entire body? Imagine the side effects. The side effects of antihistamines include hallucinations, sedation, and things in the brain. I would not give my child something like that.
But what if they're coughing? What do you do then?
Gargle with salty water, lick on honey like Shosho taught us. We darao Shosho. We think Shosho is some archaic woman who has no knowledge. Remember I told you about the Kenyan woman? The Kenyan woman is a powerful lady. Honey, 3-4 times in a day. Indeed, in Aga Khan, sorry to mention a hospital, in the hospital where I work, we actually did a study. We used one of the most powerful cough mixtures versus placebo versus honey, Trevor. And honey stood head and shoulders above the rest. Why is this not being permeated in Kenyan society? Because there's no money to be made. If I tell you to do 3-4 drops of honey 4-5 times in a day. So to my colleague who was mentioning, I do saline nose drops, 70 shillings for a bottle that never expires. Honey that never expires. I mean, it's in your, even if it gets a little bit thick and sugary, at least it soothes the throat. Paracetamol if you need it. And that is how I treat the common cold. But again, that's not the conversation for today, so I don't want to spend too much time on it.
All right. Yes. Okay. And there was also a question for Joanne there in terms of psychological support.
Yeah, there's a question there about about cough. Cough is one of the top 5 most common symptoms that bring people to hospital, and asthma is just one of the possible causes for it. So I think the person who asked the question is actually a medical person. I think it's important that we address the root cause of it. One of the reasons we don't like cough syrups is that they contain different, no 2 cough syrups are the same. They have different things that do different things at times they counteract each other. When you have somebody with a cough, you need to know what the reason for it. Some of them are actually quite sinister causes, and you need to work out what the cause is and treat that, and you eventually manage the cough. We can effectively manage more than 90% of all coughs without cough syrups.
More than 90%?
Yes.
Without cough syrup?
Without cough syrup.
So how do you manage it in that?
We find the cause and treat the cause.
Okay.
It's like pain. What's the cause of pain? Treat that.
Yeah.
Yeah.
So every cough has its own cause?
Yeah, every cough has its cough. It could be more than one cause, but the key is to know the cause for it and treat that.
So I know Dr. Dill speaks on behalf of children, but if an adult, so I'm at home, I've started coughing, it's at night, what do I do?
Oh, okay. So I think we need to know when it is an emergency that you need to rush home, sorry, to hospital to have it attended to. But cough, you need to go to hospital and be seen, and the doctors will find the cause for it and treat it.
And don't accept
people
the
cough
syrup.
cough. Yeah. Don't do that.
I've never taken a cough in my life for a cough and a cold that I have, and no adult in my family, period. Okay. Me, personally. If you gave me $500,000 shilling and a cough mixture, I'm not joking, and you told me to drink it, to keep your $500,000.
So in our hospital, we've banned cough syrups. You can't get a cough syrup. You can get one Linctus that is in essence a herbal remedy with honey in it to soothe the throat, as per what Dr. Adil said. But you can't get, in my establishment, you cannot get a cough syrup. You couldn't buy that.
There's a question about occupational health, where what do you do with companies that continue to pollute the environment? I know you're not the implementing factor on this, but as RESOC, have you raised concern about this? And what do you recommend?
So, as RESOC, we do raise concern about air quality now and again in different fora. When you look at RESOC and what it does for asthma per se, given that that's the theme today, we engage pharma in access programs. We advise the government on essential drugs list and make sure the right medications are there. We hold more than 10 continuous medical education activities the whole year, and the aim is to update the knowledge of all people who treat asthma. So clinical officers, nurses, doctors at all different cadres, to make sure that they are up to date with asthma management. We actually partnered very recently with the government to write asthma management guidelines for the country, so that we have evidence-based, validated and standardized ways of managing asthma in Kenya. And this is accessible to all doctors, all practitioners, to manage asthma the way it should be managed. And these are guidelines that are validated and that are adapted to our country and our economy. So we do a lot to try and help with asthma management.
Okay. John, there was a question about psychological counseling when it comes to dealing with asthma. What is the role of that? Is it important, and how do you do it?
The key is very important when you are managing a patient with the asthma. You have to go through the processes because you have to start with an action, an asthma control test. You have to go to the asthma action plan, and as you continue there, you continue counseling the patient, and so that you can be able to understand the symptoms that are coming and what you should take at any one time that is getting those symptoms. Because when you are doing an asthma action plan, the ACT, the asthma action test, you need to assess the patient, what he is going through, the symptoms that are coming, so that it doesn't depress. Because most of the time when you hear the patient is not able to breathe at night, you become scared. You're so scared. So you have to go through with that patient, talk to that patient, counsel the patient, walk together the journey. You have to partner with the patient as you have those plans of the action plan and also the asthma care plan, that you have to partner with the patient so that he can be able to understand and also to to remove the self-stigma, because you may not be stigmatized by anybody else, but you can have self-stigma. Okay. So how do you deal with that stigma? So you have to work together with that client until the end, so that he is able to understand the condition and how he can manage that condition promptly. Okay.
Guys, we've really run out of time here, but I'll start with you, Dorothy, to close for us this conversation. It's 30 minutes to World Asthma Day, so it's almost midnight. So what do you want us to hear from this conversation at the end of it all? Just 1 minute for closing remarks, and I'll do that for all the panelists, and then we just close it at that point. What is our take-home?
Okay, take-home is that we need to think education. We've learned a lot. We've realized asthma has triggers, we have the symptoms, and it is chronic illness. It doesn't stop. Yeah. So control is what is key. So you need to just follow your care plan with a good care provider so that you control the asthma.
Okay. Dr. Adil, 1 minute.
If you use an inhaled corticosteroid correctly, 90% of your symptoms will go away, 95% of your costs will go away. Please remember to always use a spacer. You need to make sure that your doctor and nurse practitioner, etc., are showing you how to use it. And when you go back the next time, make sure that you know how to do it again. And to be quite honest, even for adults, I would suggest that if you're struggling, use a spacer. Okay. That would be my take-home message.
All right. John?
My take-home message is this, that we empower. We are here from Nairobi. We are all practitioners from Nairobi. But what about our countries and where we are coming from? We need to empower our clinicians. We need to empower our nurses, the counties, in the way to do the right thing, so that when they are empowered, they are able to trickle that information to the client, and the patient will be able to learn more and to understand more, and even to take charge of his condition. Okay. Once you empower the clinician, once you empower the nurse, once you empower everybody that is working, you are sure that the patient that is outside there will get the best treatment.
Okay. Wika?
Use of salbutamol only to treat asthma without the use of steroids actually worsens asthma. If you're using salbutamol in an inhaler or in a tablet form, and that is all you're using to treat your asthma, increases your risk of death from asthma, it increases your risk of death from heart problems, and increases your risk of being admitted into hospital because of asthma, and actually worsens asthma control.
All right. Thank you so much for making time this evening, Dr. Juma Bwika, President, Respiratory Society of Kenya, Dr. Dorothy Ayuak, Deputy Chief Pharmacist, Kenyatta National Hospital, Dr. Adil Waris, Consultant Pediatrician and Pulmonologist at the Aga Khan University Hospital, and Joanne Gangema, who is the Respiratory Nurse at the Kenyatta National Hospital. Asante sana for making time, and thank you all for all the questions you had. We've run out of time. We've given more time. We've taken that time as well. So we only have 30 minutes to World Asthma Day. Asthma Education Empowers You. That is the theme for this year. We'll try as much as possible to give you as much information as we can. On behalf of everybody else who made this possible, and special thanks to the Daystar University for hosting us today throughout this session. All right, we say good night and God bless. My name is Trevor Ombija. Bye for now.